asked the health director, they said everyone is going to have a date with Omicron. Do you believe that?
Everybody's going to have a date. That means everybody's going to catch it.
Yes.
Let's talk about that a little bit. We've had a vertical surge of coronavirus. Let's talk about the numbers just a minute. Just short term. Well, let me go back a little longer term. I thought with Delta, when we had 490 new cases in a week, that was mid-September. It was actually September 14th, had 490 cases. I said, wow.
That's in Nash County.
Just in Nash County, thank you. And it did go down steadily after that. But then we started seeing this Omicron come along. We started reading about it, hearing about it. We knew from Africa it was coming our way. You know, in Europe, we knew it was, we were going to have it upon us. And 2 weeks ago, we had 137 new cases. Last week, we had 1,425 new cases.
Wow.
Today, I reported 4,242 new cases. So we're 1,000 cases more of new cases, more than even last week with the 1,425. Back to your question, and again, do we have a date with Omicron? Well, maybe, maybe not. Maybe this is going to be our way out. Maybe this is going to be the natural immunity that takes the pandemic to a lower level. I think we'll get another strain. I think we'll get another mutation. Whether it be worse or maybe milder, we'll see.
Or worse, yeah.
Yeah.
It could be very much worse.
It could
I've heard
be.
there is a new one that's been discovered.
Yeah. But whether this helps us get to the natural immunity and the herd immunity that we've talked about for a long time, we'll see. Will everybody have a date with COVID? I doubt everyone will, but it certainly seems like right now with this vertical surge we're having, it is highly transmissible.
Yeah, and I might even argue with you with full respect on that. When 1 million people in one day get diagnosed, and that's a conservative estimate.
Yeah.
I tell my patients that you will get COVID. Statistically, you are going to be a victim of it. The issue is whether you're vaccinated or not.
That's right.
And that's really going to be the response. Because chances are, if you don't want the vaccine, you're probably not a compliant mask wearer. And the combination of a non-compliant mask wearer and an unvaccinated, and I mean fully vaccinated, which means 3 vaccines if you have one of the messenger RNA ones, which would be, to use common language, not the Johnson & Johnson, either the Moderna or the Pfizer vaccine. If you're not fully vaccinated with the booster and you get COVID, your chances of dying are significant. Real numbers, if I could read again for this. An unvaccinated American, and this is from yesterday's CDC, an unvaccinated American is 20 times, that's 20 times, more likely to die from a COVID-related complication than a fully vaccinated person.
The monoclonal antibody infusion is in very short supply now. And it's my understanding that they're having to really prioritize people 70 and older who are unvaccinated, or people who are at extreme health risks, like older than that even, are the only ones can get it, because we can't get enough of it. For a while, the hospital had plenty of it.
Yeah, and 2 of these strains of that particular infusion therapy are not very effective with Omicron. Right. It's one, and that happens to be the rare one.
Yeah.
The one that's so scarce. You know, antibody infusion goes back a long ways. It must go back 75 to 100 years.
Yes, it's been done a long time.
Old method.
Yeah.